Hello, I'm Charles Blair. I want to talk a little bit about the Hygiene Department. You see, the Hygiene Department often is really a loss leader, and the gold standard in hygiene is for the hygienist to produce 3 times their W-2. So if the hygienist is paid $60,000 a year, we would expect the hygienist to produce $180,000. But only about 20% of hygienists are going to effectively make that gold standard. Why not? What is going on here? Well, just a little bit of background. First of all, the Hygiene Department typically is going to produce about 25 to 30% of the revenues in the practice. We find also from an overhead perspective in a well-run practice that the doctor is going to net approximately 40%, and then the total labor cost is going to be somewhere south of 30%. If you have one hygienist in the practice, we expect the overall labor, total labor compensation to be no more than about 25%. We find with 2 hygienists, though, 2 full-time hygienists ratio to the doctor, that the total labor is going to run more like 28 to 30%. Now that's assuming you provide fringe benefits such as medical insurance, retirement plans, you name it. Today's modern practice is facing about a 28 to 30% total labor cost if 2 hygienists are in the practice. So what are some of the barriers of not producing this gold standard, this 3 times the W-2? And I think there's a number of factors here. One is the coding itself. Are you really coding out the perio, or are you giving the prophies away? Another is the timeline. 30 minutes for kids, 45 to 50 minutes for adults, and an hour for the 4910 patients. Now the adults that are given, say, 45, 50 minutes, if you are taking a full series, you need additional time. So at the full series appointment, then I would suggest a 1-hour timeline. Now, why can we not effectively produce on a 45-minute cycle? There's really a number of factors. Number one is the patient needs to be there on time. So I recommend a 10-minute offset. Tell the patient to be there 10 minutes earlier than when you really intend to see them. This way, if they're held up in traffic 5-10 minutes, walk in huffing and puffing, you're really expecting them at that time. And I think a 10-minute wait is still plenty adequate in terms of customer service. Another factor is the doctor checking the hygienist. What we want the doctor to do is to have an awareness that the patient has been seen the first 15-20 minutes. The doctor should get up at the appropriate doctor time when the doctor gets a break, then goes in, checks the hygienist. This way the hygienist is never waiting on a check from the doctor. Another strategy is never do full mouth probings and bite wings at the same time. Do one or the other at the appointment. Another thing is you don't have to do full mouth probing all at one shot. You could do half the mouth this visit, and then the next recall visit we could do the other half of the mouth as far as probing and charting. This way what we're trying to do is to have a less stressful 45-minute cycle as far as the patient goes. Another thing is with the hygienist is to give them all the technology they need. They should have the latest in technology. Backward state laws should be changed so that hygienists can do local anesthetic, because after all they are providing the perio these days. The average general dentist only does a few perio procedures actually a year. And so if we can give the hygienist such things as Orikicks, piezoelectric scalers, and so forth. Also, I can't emphasize enough buying a pan. With the pan, you can take the x-ray in 8 seconds. You could alternate the pan and the full series every 3 years, 5 years. So folks, those are some tips to try to reach out for that gold standard of the hygienist producing 3 times their W-2.